Okay. All right. Good afternoon. Welcome to our North Carolina Sickle Cell Data Collection Program Town Hall with our state, community partners, and individuals with lived experience. We're so happy that you all have joined us this afternoon. We're going to hear a lot of good information and good work that's going on across our state. I'm Shelby Weeks. I'm the co-principal investigator on this program with our Duke partners, along with Piedmont Health Services and Sickle Cell Agency. I'm going to take just a quick moment to allow the other persons here on the platform to introduce themselves and their affiliation with the program. So Miriam.
Good afternoon, everyone. My name is Miriam Kale. I am on faculty at the Duke University School of Nursing, and I'm co-principal investigator on the Sickle Cell Data Collection Program. I'm a pediatric nurse by training and have worked in sickle cell disease over the last 10 years.
Hey there, I'm Mary Houlihan. I'm here from the CDC in Atlanta, Georgia. I am the project officer for the Sickle Cell Data Collection Program and have been working on our sickle cell surveillance program for about 14 years now. This is an incredible opportunity to work with the state of North Carolina along with 10 other states that are participating in the program, and thank you so much for having us here today.
Good afternoon. My name is Shamara Pope. I work with Mary at the CDC. I serve as the Associate Director for Policy for the Division of Blood Disorders. So in addition to my policy hat, I get to engage with the program on very specific issues. I also co-lead the community outreach work group for the Sickle Cell Data Collection Program. And thank you so much for having me.
Thank you all so much for being on the platform and being with us today as part of our site visit under this grant. This is the third year of a 3-year grant that the North Carolina Department of Health and Human Services, Division of Public Health, in collaboration with Duke University, Piedmont Health Services, and Sickle Cell Agency, and Atrium Health have been a part of. It's been a wonderful experience. This afternoon, we're going to provide an overview of the Sickle Cell Data Collection Program from the federal perspective, and then hear from our partners that are working with us on the North Carolina Sickle Cell Data Collection Program. So I'm going to yield the floor to our Centers for Disease Control representatives, our project officer, Mary Houlihan, and Shamara Pope, who are going to talk about the CDC and their role with this program.
Thanks so much. So just a quick overview of the program. As I said, we're working with 11 states, including North Carolina, on this 3-year program. And the goal is to use information, data that has already been collected, identify individuals in that data with sickle cell disease, and better understand their healthcare utilization, their health outcomes, with the hopes of providing that data to individuals, to groups who can use it to improve the healthcare system and improve the lives of people living with sickle cell disease. Data, time and time again, has been shown to be very instrumental in helping to change policy at a local level, at a state level, at a federal level, in conjunction with information provided through stories, through personal experiences, through lived experience of people with the condition, in this case, sickle cell disease. So we're really, really excited to partner with North Carolina. The team that has been built in the state to work on this program is phenomenal. It includes people with many different backgrounds, people with a lot of different experiences, a lot of different expertise coming together to really make a difference. At the national level, with the 11 states, the goal for this program is for it to become a program that does cover the entire United States and the territories. The goal is for this program to inform other efforts, to inform efforts that are funded by the National Institutes of Health, by different government agencies, by different federal agencies, to help improve the work that is being done on the ground in institutions that care for people with sickle cell disease, again, to really help change policy for these individuals and for the sickle cell disease community as a whole. To make improvements to change people's lives for the better. There have been a lot of progress, a lot of positive movement in the years that we've been doing this project, both within North Carolina and other states. The data has been used to show where there is the absence of sickle cell disease clinics, and new clinics have opened. The data has been used to work with Medicaid programs to expand services and benefits across the lifespan for people living with sickle cell disease. The program has been used to do outreach across the state to improve mental health services, to improve behavioral health services. It's really very wide-reaching to see all of the avenues that can be touched by having this information and using it to talk to people who can make decisions. We're excited about the opportunities ahead. This 3-year program is coming to an end, but we've just announced that there will be a new grant cycle of another 5-year project. It is open for all states to apply. We will have funding. As of right now, we have funding for 13 states, so it's growing by another 2 states. We anticipate that there may be opportunities for growth to additional states in the future. And we're expanding the work that the program is doing in this upcoming funding cycle. We're looking to improve not only healthcare policy with this data, but to improve policies that affect transportation, housing, education, employment, really all of the different pieces of a person's life that are needed to make a healthy, whole person. So we can't wait to see what comes out of this project in the upcoming years. And I would just close by saying, we're here, Shamar and I are here, even though we're in CDC, our doors are open. If any of you have questions about the program, if any of you have questions about what's going on within the federal government when it comes to sickle cell disease, there is a lot. I've been doing this for 15 years. I have never seen so much going on. I have never seen so much engagement. I have never seen such a high level of interest. When the Secretary of Health for the entire United States reaches out and wants to know more about sickle cell disease, that means a lot. And so it's truly an exciting time, but I think it's important for everybody to be aware and knowledgeable of what's going on. So if you have questions, in addition to reaching out to the people in North Carolina, you are more than welcome to always come to us. You can email us, you can call us, you can come up afterwards. I'm happy to give my email address, my phone number, talk to us. If you have concerns, if you have, input, positive or negative, we are absolutely open to it. So we can only improve the program if we know what improvements benefit everyone. So please let us know. And I will turn it over to Shamara to talk about a little more about policy, but thank you so much for having us here.
So our policy and partnerships work in sickle cell has grown tremendously over the years, and one thing that I'm very, very excited about is our ability to collaborate with not just our national partners, but also our federal partners who are fully engaged in sickle cell work. Each federal agency has its lane, has its responsibility, and certain authorizations and appropriations to do that work. But more and more, we're understanding or emphasizing the impact of having a single voice and a strong message that to make progress for people living with sickle cell, we have to do it together. We have to do it collaboratively, linking arms and walking forward together. So I, just as Mary said, I encourage folks to better understand what you can do in the policy world. Everyone has a voice in the policy world. You don't have to understand all the lingo and legalese that comes with it, but your lived experience, whether you're a person living with sickle cell or you're a caregiver or you're a provider or you're a neighbor or a teacher, you can play a role in the policy realm. So CDC has a responsibility to communicate how we fund programs and the impact that's being made. And as much as possible, we want to hear those community level accounts and stories of how the data that's being collected at the state level is impacting lives and impacting programs. And so I get to work closely with the states to understand what that means, how to educate people in Congress, how to make sure that folks in DC understand what's going on and the impact that's being made and how much more we could do with collective resources. So I'll just end with that. And I'm happy to answer questions during and after the town hall.
Thank you both for your opening comments. We appreciate your support and especially you being here today. to hear from the voices of those working closely with this program. So we're going to transition to have an overview of the work that's going on in North Carolina. So my partner in crime, Miriam Kale from Duke University, is going to provide an overview of the work that's going on. Miriam?
So I'll start with the disclosures. First, whatever I'm presenting today does not represent the views of the Department of the North Carolina Department of Health and Human Services, Division of Public Health, and then our funding from CDC, acknowledging that funding as well. So as Dr. Houlihan mentioned, we are one of 11 states in the nation receiving this funding to build a program to understand where people with sickle cell disease live, what are their healthcare needs in the state, and how can we best address those needs. What you see on the map is the states highlighted in red are the ones that are currently have a surveillance program up and running. I'll add to what Dr. Houlihan mentioned is that the 11 states work very closely together, and we collaborate both on the data end in the sense of learning from each other and the challenges we might have with the data, and we share experiences. So this is more of a really very well-connected network of 11 states working collaboratively to better understand the picture of sickle cell disease in the nation. I'll present some of the data that we have from our program, and I'm starting with the birth in the state of North Carolina. So on average, we have about 90 births per year of people with sickle cell, of children with sickle cell disease. 91% are Black, 5% are Hispanic. About 52% are male, but most of those births, I think what is important in this graph is where these births are occurring. And so if you look at the map and you see the shaded areas in light pink, that's about 1 to 25 births over a period of 5 years. But the areas shaded in red, the four counties, Mecklenburg, Guilford, Wake, and Cumberland, are the highest birth with sickle cell disease, and the numbers are on the screen. And these are 5-year numbers, so it's not the annual rate for those counties. I think what's important to note is where are these births occurring relative to the sickle cell centers in the state. And so the blue H marks and the gray H marks mark the areas of, or mark the institutions that have been designated as a sickle cell center, receive funding from the state, or provide services for people with sickle cell disease. And you can immediately see that Cumberland County is one of those counties that has a high birth rate of infants with sickle cell disease and limited resources in the area, limited sickle cell centers or access to sickle cell centers. This is where this data can be powerful and can help inform where services are needed for people with sickle cell disease. The second slide presents how people with sickle cell disease in North Carolina use emergency department and hospital services. And this is data just from 1 year, from 2017, but based on our data, it looks pretty much consistent. And if you compare the previous slide with this slide, you see the same counties light up again, with Cumberland being underserved in the sense of there's not a lot of sickle cell centers in there. The other thing we've noticed looking at this data is that most of the people live in those 6 counties, but also most of the people were younger than 30 years of age. When we look at who is having high utilization, meaning high ED and emergency department and hospital visits, 2 things come up very clearly. The young adult age group, those who are 20 to 29 and 30 to 39 have the highest emergency department visits and the highest hospital visits. The blue bars are the hospital admissions during that year, and the red bars are the emergency department visits per year. And the x-axis is showing the age group distribution. So you can immediately see that the adolescent young adult group is really the one that has high visits in the state. When we look at who is paying for those visits, Medicare and Medicaid gets the biggest share. Medicaid pays for 48% of all emergency department visits, and Medicare pays 30% of all emergency department visits. Those are the red bars. And I just noticed that you cannot really see the blue bars very clearly. Same with hospital admissions. So most of the acute care visits, emergency department, and hospital visits in the state are paid by Medicaid and Medicare. Private insurance covers about 13% of those, and few are self-pay, about 2 to 6% of those visits. So this data is really helpful in helping us understand where are the needs for the state, what areas are underserved, what are the healthcare needs of the people living with sickle cell disease in our state. And I'm going to share a couple of examples of how we've used this data to inform initiatives across the state. The North Carolina Governor's Council has a medical research committee. That committee has made a priority improving ED visits and hospital ED pain management for people with sickle cell disease in the state. As we know, this is the #1 complaint for people in North Carolina. So they've made that a really high priority for them. A team of clinicians from multiple sickle cell centers across the state came together, and they've developed a toolkit to help inform how we manage pain in the emergency department. They want to distribute that kit to multiple emergency departments across the state. So they came up to us, to the Sickle Cell program, a Sickle Cell data collection program, with a request to help them understand who should they target, what facilities should they target with that intervention, so that they can strategize to whom they disseminate that information. And so what the Sickle Cell data collection program did was provide a list of facilities in North Carolina that had the highest number of ED visits in the state. And that's what you see on the table kind of on the side. And I've removed the names of the facilities for confidentiality. But this way we provided them with a list of the highest facilities with the highest ED visits, so that they can potentially start there and hopefully improve care in those areas. And this is a big initiative that I am not really at liberty of talking to, because our involvement is merely providing data. So I think if you have any questions to that, I'm happy to connect you with the people concerned. I saw a hand come up. Yes.
Yeah, I wanted to ask what the tools, the kit involved exactly. Was there holistic options, or is it just medication?
Yes. So I'm gonna ask that we hold on that question till the Q&A, and I would ask one of our co-investigators on the grant to give you that information in a few minutes. Thank you. The other thing is that we're working on is building on this data. We're trying to develop material that can inform both providers who take care of people with sickle cell disease. So building that information in material that we can disseminate and share with both clinicians and providers, so that they understand where people are, what are their healthcare needs, as well as providing resources to people with sickle cell disease. For example, on the far right, you see the North Carolina Sickle Cell Data Collection. You see a pamphlet that's currently in development that's being led by our partners at Piedmont Health, that would include who is by region, who is your social sickle cell educative counselor for the region, as well as what is the nearest sickle cell center available for that region, to help connect people to the right resources available in the state. On the other two the other educational material that we're working on will help inform providers on where patients are, what are their healthcare needs, and how they're using the healthcare system. This is currently in development, so we have not disseminated this information yet, but we're sharing kind of where our target moving forward is. I'd love to hand over to our partner at Piedmont Health, Justina Williams. She will talk about what is coming up from their end in terms of patient engagement activities available moving forward.
Good afternoon, everyone. I am Justina Williams. I'm the patient engagement coordinator with Piedmont Health Services and Sickle Cell Agency. So some of the things that we've come up with while doing research and surveys with people living with sickle cell, we found that
All that time.
hello, you guys can hear me now better?
Yes.
Okay. We found that a lot of people wanted more information outside of sickle cell and different life skills and things of that nature. So during the pandemic, a lot of people were lonely. So we created Zoom Into You, which is a platform where we talk to doctors, people who are like lawyers, insurance companies, and things like that, where they can get information about sickle cell disease and other topics. Knowledge Matters was created with Novant Health for ages 13 to 24-year-olds to discuss transition and how that happens and what are all the things that come with transition. So that is a monthly meeting that we also have. Our town hall meeting, which is happening today, is for all age groups. We came together with the CDC, with Duke, and we're all working on this project, and we wanted to make sure that we're relaying the information to the sickle cell community. The teen support groups, that happens in all of our areas. It's like Zoom Into You, but we also have in-person teen support groups. Recently, we took a group to the Eastern Shore to the museum, and it was about a 2-hour experience at the museum, and then we did our teen talk, which is what we call our teen support groups. And in the summer, at our enrichment camp, we will have the Teen Summit, which is where we'll do different activities such as life skills, college prep, and what it's like transitioning with sickle cell disease. And we'll also do our readiness assessments to assess how far they are, teenagers are with learning about transition. And then our Sickle Cell Awareness Conference will happen in this year, September, which is Sickle Cell Awareness Month. We will have it in collaboration with the DHHS and all of the communities across North Carolina. So, thank you guys.
Before we transition to the panel, I want to address if there's any questions about the program. And I don't mean to put you on the spot, Dr. Shinabi and Dr. Strauss, but would you be willing to elaborate a little bit on the content of the toolkit that is going to be available to address pain in the ED?
Sure, thanks for the question.
Do you want?
Hand me that one.
Oh, is that portable?
Yes.
Okay. Thank you.
Keep the light on. It should be on. We turned it on.
Hello?
There you go.
So thanks for the question. The toolbox is actually to treat acute vaso-occlusive crisis pain in the emergency department. So doesn't have a lot of non-pharmacologic interventions in it because it's based on the guidelines for American Society of Hematology and National Heart, Lung, and Blood. So it does have opioids, it does have some non-steroidal guidelines as well, but it's a much bigger toolbox as to how to actually implement those guidelines. Everything non-pharmacologic, or you probably would be there. Those are really important pieces of managing your pain and preventing, but by the time you get to the ED, you know, you probably need something more than, and warm blankets and all of that is really important too, and we do that, but like the stress is on the system and how to implement and provide support. If that answers the question wherever it came from.
My experience with my mother having sickle cell is a little bit different and how we manage her pain. So the reason why I asked that question is because we know that the opioid epidemic is such a big issue, especially in the Black community, and we have an issue with sickle cell anemia. So getting the pain management definitely doesn't always need to be dealt with drugs. So I've learned with my mother that massage therapy, her diet, making sure that she gets the proper oxygen, whether it be from water or cleaning. Certain things just help with that pain management. Because of that, it's been about 4 or 5 years since she's been to the hospital as of recently. So when it comes to trying to fix that issue of pain management and teaching the community what other options they have in getting that, what's the direction with that?
So this task force is really all about emergency department care. So that's what this particular task force is about, is improving the care in emergency departments for patients with sickle cell. So when, you know, maybe in 5 years and that isn't working for your mom, when she does have to come in, that she would get the care that's evidence-based. I think there are guidelines, and perhaps Dr. Strauss and I see Dr. Desai here, maybe the other guidelines within ASH and NHLBI for the treatment of chronic pain probably address more of what, you know, the interventions that you're talking about that are crucially important for the manage of chronic pain and prevent the need to come to the ED. So.
I think that you know, when we think about treating people's pain with sickle cell disease, and one of the things we want to do in the emergency department is individualized pain plans for the person. So part of that toolbox is trying to have the individualized pain plan. Now, unfortunately, we can't really get massage therapy into the ED very easily right now, but we can make sure that if it works for someone, that's something that's in their plan. And I think that when it comes to what works to prevent pain, that's really working with your individual doctors and knowing the person. And the same thing that could be in someone's individualized pain plan for home. And we do know that there are some non-pharmacological approaches, alternative medicine approaches that can really help prevent people's pain and help treat people's pain. And some of those are included in the guidelines. And some are ones that people are currently studying, like acupuncture for acute pain and acupuncture for chronic sickle cell pain. So I think those are important as well. And there's some interventions we know, like there's increasing evidence that some of the virtual reality games can help with pain in children. But getting those set up in the emergency department is sometimes a little bit more challenging. So I think you'll see them in other spaces first.
So I know the child just said I guess the long-term care in this round.
So, you know, most of the long-term outpatient care is provided by hematologists with an interest in sickle cell disease. Some of it's provided by primary care doctors, pediatricians, or internists, but most of that's done by sickle cell doctors or people interested in sickle cell disease, mostly in sickle cell programs.
So no one in this room.
Well, I'm a sickle cell doctor. Dr. Desai is a sickle cell doctor and runs the program at Atrium Health, leading Atrium Health in Charlotte. I'm at Duke. So there's some nurses in the room that provide sickle cell care as well.
Any other questions?
In your slide, it mentioned about the 6 counties where most of those births were. Oh, wait, Susan, please. Sorry about that. On your slide, it mentioned that 6 counties where most of those births were with sickle cell disease. And I saw Mecklenburg, Wake, Gifford, Cumberland, and Durham. That accounted 5, but maybe I missed one. I apologize. I said Cumberland, Mecklenburg, Wake, Gifford, Cumberland, and Durham. And again, I may have missed it, but.
You're right, I'm missing one.
I did.
Yeah, I'm missing one.
Is it out eight?
I'm missing one.
Okay, and I
It
wasn't
should
trying to.
say 5.
Oh,
It
fine.
should say 5.
Okay, yes, thank you. Sorry about that. And my other question is, when it says sickle cell disease, is this for SS disease? I'm assuming?
It's either SS, S beta 0, SC, or the other forms, SD, SE.
So long as it has one of them is sickle.
Yeah.
So one of them must be sickle, but it doesn't
Yes.
just, it's not narrowed to just sickle cell SS.
Not specifically sickle cell anemia. So it
Right,
can be
right.
any of the other forms of sickle cell disease, but not trade off.
Okay, thank you very much.
You're welcome.
This will be the last question.
I'm not sure if this will reach back here.
I understand. Myself, I believe with sickle cell for a long time. Is there here in Guilford County, they only have one sickle cell center, and they only open to, for a few hours. Is there any way where they have a center where we could always go to where, overnight? Because living with sickle cell, anybody that knows about sickle cell, it comes at any time, and there's nothing you can really do about it. Sometimes when you go to the ER, it takes hours and hours, and you right there with a lot of pain, just trying to get back there. Sometimes they'll just tell you it's not enough room, be patient, but I'm in a lot of pain. So how do you do it? So, things of that nature.
I'm gonna defer to Dr. Stoss. Do you know if there's any other center in the area that can take patients after?
So I think you're referring to the Cone Health Sickle Cell Program here in Guilford, which I think that is one of the challenges, is that the day hospitals that treat sickle cell disease, with one exception, there's one at Grady in Atlanta, it's open up 24/7. Are usually just open up during kind of daytime hours. Some are open on the weekends, but many are not. So people end up in the emergency department, and that's why one of the focuses on care is recognizing that we need to be able to provide good care for people with sickle cell disease in the emergency department, and that means getting them pain medicine quickly, getting them the right pain medicine, making sure that they're treated with compassion, and that we also recognize other serious illnesses that they can be having related to their sickle cell disease or unrelated to their sickle cell disease when they're in the emergency department, that we just don't focus on the pain, but we make sure that other serious conditions are taken care of. And to how our health system works, we recognize that people are going to have to be in the emergency department for some of their care. We would like to get people other settings of care that are friendlier and easier to access, and where you don't have to wait with everyone else. But I think it's hard to pull that off close to home for people 24/7, just based on the number of people with sickle cell disease in the U.S.
I think to further expand, I think the Governor's Council, one of the things we were charging people to do in terms of DB care is figure out other ways that people could get care during the day, maybe even at night. Ideally, that would be 24/7. But every institution works a little differently. So the goal of this is to say, here's the problem. We're defining it for you. Let us work with you to come together on a solution so we can help people get the care they need, whether that's quick care in the ER. So we can, one of the guidelines is trying to get pain control within 60 minutes of hitting the door, or whether that's working with other people, such as sickle cell centers, to figure out outpatient care or urgent care 24/7. But I think that is the goal, and that is the charge for what they're doing with this toolkit, is starting that conversation to say, there's not enough, and how do we make it better? Does that help?
no further questions, we will be moving on to our panel discussion, which I will be moderating. And thank you to our Sickle Cell warriors who are here with us. We'll start by introducing Mr. Ron McCrary. Mr. Abraham Williams. Ms. Patricia Christian. Ms. Felicia Higgins. And Mr. Jeffrey Wilkins, who could not be here, but he is in the chat. So if you guys could please start off, Abraham, by introducing yourself. Just 1 to 2 minutes.
I'll be very brief. My name is Abraham Williams III. I go by AJ. Of course. Sorry. Can you guys hear me?
Yes.
Okay. Abraham Williams III. I go by AJ. Just a little bit about myself. I'm a musician. I play drums, also piano and organ in church. I'm a traveling musician, as well as I do work for the Red Cross. I'm also one of the counselors. I participate as a counselor in the Piedmont Services summer camp for Sickle Cell. So that's one of the things I'm pretty proud of.
Good evening. Can you guys hear me okay?
Yeah.
My name is Patricia Christian, and I am actually from the Caribbean. I was not born and raised here in the mainland, but I am from St. Thomas, Virgin Islands. I am 49 years old, and if we will let me live, I'll be 50 on my next birthday in December. So I'm excited about that. I lost my mom to sickle cell disease as well when I was 5. She was 47. And so for me to reach this milestone in my life has been extremely exciting and a blessing as well. I have one daughter who just turned 25 yesterday. And so that again was a big deal for me because my mom didn't get to see that. So living here has been a blessing. I have partnered and worked closely with Piedmont Health Services, not just as a client, but also a volunteer. And I just love the purpose that sickle cell disease brings to my life. When I found out that I had sickle cell when I was old enough to understand, when I was little, instead of being mad about it or upset, of course I didn't like the challenges that it put on my life and the restrictions because I wanted to be like my peers. But I embraced it, and I just thought it was a part of my purpose, no different than my skin color, my eye color. So thank you for having me, and thanks to everyone that's here and the role that you play in our lives. It really means a lot.
Hello, my name is Deborah McQuarrie. I too have sickle cell disease. I am supported by friends, family, my daughter's here, and I'm very happy about that. Living with sickle cell is a lot, but we get through it. I'm very happy to be here. It's a blessing. And chiming off of, or piggybacking off of what she said about living and her birthday, I'll be 54.
Hello, my name is Kalisha Higgins. I turned 44 in January. I am a mother of 2. I have a son and a daughter. What do I do during the day? I'm a colorist, so I'm a licensed cosmetologist. I did my undergrad at NC State. And at that time, I had, my dream was to be a hematologist. Fast forward in the future, hope to be, earn my PhD in public health and advocate and research more regarding sickle cell disease. I was recently appointed in September to the Governor's Council I'm excited. But I'm excited about that. And I am too an artist, a singer, and I travel. And I also serve on my praise and worship team at my church. I love God. And I'm grateful for all of you in this room. I'm grateful for the opportunity and invitation. So my representation here is twofold. And my diagnosis is sickle cell as beta plus. So here I am. I'm here for you, for us.
Okay, so I'll start with the first question. Describe your experience living with sickle cell disease. Anyone can start. Describe your experience with sickle cell disease.
Living with sickle cell disease, in my younger years, it was very challenging. But then again, maybe not, maybe during my high school years, my mom didn't treat me like I had a disease. She treated me like a normal child. Growing up, I just lived life to the fullest. When I had my first episode in high school, that kind of changed it for me because I spent weeks out of school. That takes a toll, and then you're kind of held back because you're missing so much. But as I got older, I had to learn how to take care of me. And that changed a lot. You know, like my daughter said in the audience, she's been riding this ride with me, along with other family members and support team. It's not easy at times, and it's scary, you know, especially when you have an episode. But we make the best of it. We make the best of it.
Thank you for that.
So living with sickle cell disease, I would say as a child, and speaking to the mother who was speaking earlier, it's very important for you to know whatever it is, who you are from the beginning. And so for me, I was adopted at birth. And for some reason, they could not figure out who, which parent, why. I was born with this. And I don't remember ever not knowing. So to my parents who adopted me, I've always known, they've always educated me about it. Having that village is very important. Knowledge is extremely important in all things. So going through school as a kid, as an athlete, I knew the things that maybe I should not do. My teachers and everyone knew. Everyone always knew, you're that girl, you know, the sickle cell, what is that? And then, you know, of like T-BOS and different people, they're like, oh, you have that disease that they have, but they still just don't know. So my parents would do everything to educate me about it, and I would know, like she said, how to take care of myself. Very young, you have to know what to do for yourself, how to speak up for yourself, how to educate people about caring for you and knowing what to do because mom and dad may not always be there, and making sure everyone around you understands what needs to happen in their absence. Fast forward as an adult, it's actually harder getting people to listen. They have all these stereotypes and stigmas. Understanding that there's not one person who experienced sickle cell the same. There's not a look, there's not a color of your eyes, there's hair, nothing. When you look at me, had you not been here for this meeting, you would not know that I have sickle cell. Correct. So that is the biggest thing now, and why I'm so passionate about it, because no matter how many conversations that we have about it, you still have the ones that aren't listening. I am the patient. As the provider, you have the education, but I live with it. So we have to work as a team, and this is what's going to help me survive and have better quality of life. And so I'm just 10 toes down on it. I'm standing firm on advocating and speaking up for myself and correcting people and giving my perspective. And so that's what it is like now with sickle cell disease.
For myself, like I mentioned earlier, because I grew up in the Caribbean where healthcare wasn't always the best, it was a little challenging. I, much like yourself, I always knew about my sickle cell disease diagnosis. My mom didn't get to teach me a whole lot, unfortunately, because she left when I was so young. But she did leave me some knowledge because my mom, I would always make fun and say how my mom would make fresh carrot juice and fresh beet juice and make me drink it. She would drink it obviously, but I couldn't stand it. But she just there were certain things that she did by example, and now I have adopted that type of lifestyle for myself, and I realized that she was teaching me, even at such a tender age, how to take care of myself. My dad, he did the best that he could, knowing what he knew from living with my mom, and he did the best that he knew how to do. I had peers that I went to school with that had sickle cell disease, so we were our own little community. And so we shared our similarities, we shared our differences, and we supported each other. And so that was pretty cool, having that support. Unfortunately, the vast majority of my peers have since gone on. They have passed away. And so, again, I am blessed to have been, chosen by God to still be here. And again, I feel like it's a part of my purpose. Growing up as a teenager, it was challenging because I had to find my boundaries. I wanted to be like my peers. So there were times when I wanted to party all night. I wanted to drink alcohol because my friends were doing it and do different things. And unfortunately, the next morning, they would maybe have a hangover or just go on about their business, and I would be the eating. So I had to figure out that there are some things that my peers did that I couldn't do. Did I like it? No. And then some of the challenges that I faced as an adolescent, young adult was in the Caribbean, back then, they didn't give pain medication to take home. So if we got sick and we went to the hospital, we were treated accordingly, and then we were sent home. There was no, here, you take this if you have a pain crisis at home. So we just did the best we could, and when the pain got overbearing, we had to go back to the hospital. It was just that. So there was no pain management at home. So it was challenging doing that. So moving to North Carolina and experiencing a different type of healthcare, it was like a whole new world, but it was awesome because I had support. I felt like I could talk to my hematologist, something that I never had the opportunity to do as a young adolescent or as a child. I didn't have anyone that I felt understood. And I think that's one of the biggest things, feeling misunderstood. People can empathize with you and they show compassion, but who feels it knows it. That's one of my biggest sayings. And unless you understand, you just don't get it. And we get it, that you want to get it. But I think that why that dialogue and that communication between ourselves and our caregivers is very important. I've had doctors that tried to dismiss my opinion because they felt like they had that textbook knowledge. And that doesn't work. Like you said, what works for her may not work for me. What works for me may not work for him. I might need something less, like I can't tolerate high doses of medication. I've had issues with that, even at my highest pain level. My body is very sensitive, so I have to let them know immediately. I have to let my sweetheart know, my daughter know, which they have come to know. If I go in and I'm not able to communicate with myself, these are the things that I need you to communicate with them. Because some people come in and they can tolerate higher doses, I can't. So I think that communication and that dialogue between physicians and patients and things like these and different trainings and different informative events are very important. But I do thank y'all for being here.
Thank you for sharing that.
Okay. The question was about
Describe your experience with sickle cell disease.
And first off, I am, I'm 29, well, I'm 28, I'll be 29 in July. My life living with sickle cell, it's been a journey of learning the ins and outs of the struggle dealing with sickle cell. It's been not only learning it, but also embracing it. To piggyback off of, what my peers have said about, there were times that that we, would want to do some of the stuff that, our peers and friends would want to do at school. And I feel that living with sickle cell um, it's a daily experience of, as you learn, you're also teaching others. We've had to be teachers for not just our friends, but also for doctors and parents and other people that care for us. Like Miss Patricia said next to me, she said that uh, no matter how much textbook or information or research you may have, it's not going to be the same as um, actually being in our shoes and dealing with the sickle cell experience firsthand. There's days where it's up and down. There's days where I've felt like Superman, and there were days that, yeah, there's been days that I really felt like I could do it all. I like to go to the gym, run. I wish I would have ran track in high school, but there's also been days where uh, we have to learn our limits. We have to learn our limits and learn, when enough is enough. Or sometimes you have to take extra self-care days. There's been a lot of times, and of course, we all know we may need extra, a couple more extra self-care days to, yeah, self-care we need it to, cover. I'm not sure, of course, the experience is different for all of us. I know for myself that, the times that I were in the hospital, say if I was in there for a week, it would take me almost double the time to have to recover or try to get back to what my normal is. Um, so that's pretty much what the life of living with sickle cell is. It's learning your limits, learning your body, um, learning how different weather might affect you, or different atmospheres and climates. You have to learn the ins and outs of your body, um, and not just weather or climate, but also having to deal with how different foods might affect you, your diet. All of that is important. So it's our life is learning. Um, we never stop learning. We should always be postured. Um, when you're outside looking in, you should always be postured to learn. You should always be in a posture to learn something new. So that's what our life is. It's learning about what we deal with, because it's ever changing. The disease is ever changing. There's multiple facets to it.
Thank you for that. Okay, our next question is, what is the biggest challenge in the sickle cell community right now? And I would like Ms. Higgins to answer that question.
I hope I did it right. I think we all do this. Well, I believe that the biggest challenge is the breakdown in the communication from patient to provider when we are in need, the access of care, the having access, quality of care, and just when you walk in the doors, let's say in the ED, the judgment that begins, or, I've been living with sickle cell disease 44 years.
I may not be kicking and screaming when I come through the doors and I need pain management. I may have tried for me at home, I have a rule of thumb. I'm not gonna take my medication more than 2, maximum 3 doses of it, so that there's not that level of dependency. So I'm gonna go into the ED if I can't control it after that. That is what I do for me. That may not be where everyone is, that may not be their case. But when I come in, I'm very much on top of it, I feel, as a patient. So I may not give you the kicking and the screaming and the hollering. You know, I may express my pain differently. It may be a and a that type of thing. So I believe that definitely is huge. I'm grateful for my hematologist at UNC. I live in Raleigh, North Carolina, so they have a plan. Um, I'm not sure if everyone has that in the hospitals or through Epic or whatever it is they're using, but I think that's very important to have, to know what my doctors who see me, who treat me, what we have discussed will work for me. And then when I'm in the ED, you start there and you're not guessing and you're not doing, well, Patricia came in here yesterday and this is what we did for her and it seemed to work and it was wonderful. So let's start with this. No, it's me. This is what I live with and this is what works for me. Don't give me something that you heard that's new and amazing. That's not the time in the ED to try something new. It's time to do what works for me. And I say that respectfully because I go and I make sure I let someone know I'm going in if I don't have them with me. I'm really good with speaking up for myself, but that's not everyone. And I think it's important as patients, we have someone that's there to advocate for us, someone on speed dial, or call your provider. I call them all the time, hey, I'm about to go to this place I've never been before that happened to me recently. And I usually try to go to the same place, but I happen to go somewhere different. And later on, we get into that was horrible. But anyways, I called my doctors and they were on top of it. They were on top of it. And the doctor overlooked the whole plan and everything. That's right there to read because you want to do what you are excited about. And that's not the time to reinvent it. So that, for me, I believe is the biggest issue for us.
So what you're saying is to have a patient care plan.
Absolutely, everywhere. Every single hospital, I'm not sure who decides, but it needs to be, that conversation has to be had and not a long conversation. It should be implemented because you may be a hematologist, but you may not have the training as much with a sickle cell patient. Like I see my nurse practitioner a lot, and she's actually the one who's doing the work most of the time and who sits with and spends the time with the patients more so than the doctor who may be flexing back and forth with maybe a cancer patient or other disorders, but my nurse practitioner spends most of the time and she has most of the training hands-on. So I think we need that plan in place in the hospitals, to play the devil's advocate. No, you don't see me, you don't know me. And you're just trying to get to know me quickly with all these other patients you have to treat. And that's the best thing, to start there and to have a baseline and not coming up with something out of the sky or, like a new and improved, something you want to try. I'm not your guinea pig and we're not doing the research right now. You want to get this person comfortable after they've been sometimes waiting 10 hours in the ED.
Thank you for that. Abraham, questions?
One more thing is one of the.
Sorry. What has helped you get to where you are as a patient advocate, and what advice would you have for others who want to do the similar work that you are doing?
Okay. What has helped me to get to where I am now? Well, I would say first off, not only a shout out, but I pay a lot of the. I give a lot to my mom. She, the moms are the ones, the backbone. They teach us to be advocates for ourselves, as well as Kalisha said, our mom is the person that's, there training us, the trainer, the nurse, the doctor, the chef, everything, there's not much that you can't do without your mom. And so, my mom has played a big part in me, being able to not only take care of myself, as well as being able to help take care of others and teach others about sickle cell, as well as another thing that has helped me out is talking to other sickle cell patients, learning their perspective, doing research on my own, of course. Of course, you can always read and hear something from somebody else, but you always have to do your own research and go back and fact check on your own. What was the other part of the question?
What advice would you give someone who wants to become a patient advocate?
So my advice would be to a patient advocate, not only notate the experiences that you go through, but also get insight from other patients as well as insight from doctors as much as possible. It's important to look at all perspectives and all every different perspective of what sickle cell is in order to get a understanding of how the disease works, what's needed, what's effective and efficient, as well as understanding the emotional and the mental side of what goes on with sickle cell. Because it is the journey with sickle cell, it's not just a pain thing. It's not something that, only brings pain and just, when the pain is off, oh, everything is fine. There's things that, are left behind after the pain. It just like medicine and other things, the pain that we deal with, it has side effects. So my advice is to learn as much as you can. And I think that'll help out with whatever you're trying to conquer.
To Ms. Patricia, how important is it for people living with sickle cell to be engaged in their health care?
I think it's extremely important for persons that live with sickle cell disease to be engaged in their healthcare, because who better knows you than you? We can all have support systems in place, friends, family, and loved ones. However, who knows the individual more so and better than the individual themselves? And so I think it's extremely important, and not just even when we get to the ED or get to the hospital, but also starting at home. I think that what we do at home plays a big role as well. Again, just like as we've all talked about, how important it is to take care of ourselves, take those self-care days, rest a little bit extra, learn your triggers, weather changes. I had to learn that moving from the Caribbean, where it was extremely hot all the time, to somewhere that actually had 4 seasons. I've never experienced that. So needless to say, first few years, my body had to adjust at night. Spent a lot of time in the hospital learning that. So activity levels, diet, and exercise. Like I said, my mom set an example when I was little, and I didn't know that 40-some years later, I would be doing some of the same things that I gagged when she tried to get me to do them. So I'm still thankful for that. But I think we're responsible. We have to take responsibility, and we have to teach each other. Our experiences are made to pass along to our younger generations, those that are coming behind us, beside us, along with us, and letting them know, hey, I can do it, you can do it. My triggers may not be your triggers, but let's find out what your triggers are. How can you speak up for yourself? What does that medication do for you? that doesn't work for me, or I don't like that. Do you like that? How does that affect you? And things of that sort. So I think it's very important. Again, who best to tell them or anyone about you but you?
Thank you for that, and I'm glad that you brought up that future generation question, because Mr. Brown, the last question is for you. Because you're the oldest on the panel, but you have a lot of wisdom. And you don't get to her age without a lot of wisdom. If you could send a message to the future generation of the sickle cell patients, what would your message say?
My message would be, learn yourself. Also, you have to forgive yourself because we beat ourselves up a lot. And it's not our fault. Once you learn yourself and you forgive yourself, don't let life beat you. Grab a hold on to the reins because, life is not easy, but you can make the best of it. And we sit here, we've made it to where we are today. Age played a factor for me. They said that, the doctors said that I wouldn't make it past 21. I'm 53. They said that I wouldn't be able to have children, and excuse me because I get emotional. They said I wouldn't be able to have children, but I have 3 adorable monsters at home. And my daughter is sitting out in the woods, so. And they said that I wouldn't be able to play sports. I played softball. So I defied a lot of odds against me. So whatever they say, challenge yourself. Every day is a challenge because we have pain and we have to deal with it. Our caregivers, they have to deal with what we go through daily. Like I said, the support team is amazing. I have some near and far, but to the future, just ride that wave. Don't let life get the best of you because you can turn that around and have the best of it. I have sickle cell, but it doesn't have me, and that's what I live with every day. So.
Thank you. Can everyone join me for a round of applause for we're going to open up the floor to questions.
Yes.
What did you mean by forgive yourself? What did you mean by forgive yourself?
For a long time, I thought it was my fault because I have this disease, but it wasn't. Like we said, we're here for a purpose and to be a testimony. We're all walking testimonies of this illness and what we've gone through in our life. So I had to forgive myself because it's not my fault. It was given to me, I embrace it, and I walk with my head held high. So to me, that's what forgiveness meant.
I don't have a question, but I want to have a comment on the panel as to here and to give everybody some hope. So we talked a little bit before about the toolbox for emergency departments, and many people in this room have been working on this project for probably at least a year. And I've been doing work in this area for a very, very long time. So part of the toolbox is going to be encouraging each hospital system to develop individualized pain plans for individuals with sickle cell. So working with your hematologist, putting them in the ED, in the medical record, not only for the ED providers, but for you as an individual living with sickle cell in your medical record. So you could pull up your pain plan written by your hematologist and go to any emergency department anywhere really, maybe in St. Thomas, I don't know, or St. John's, I don't know. But that's one of the key, because that's one of the evidence-based recommendations out there, is that every individual has their own individualized pain plan written by your hematologist, available to the EDs, and then available to you now as a patient. And we've done some research in this. We've also shown that when you put those plans in place, emergency department providers will follow them. So we have that data, they will follow them, because it is that the ED providers actually do want to do the right thing, and sometimes they just don't know how. Sometimes they have a lot of stigma and a lot of racism, but a lot of times they just don't know how, and it's really quick and it's really overcrowded. So that's why we're hopeful that this toolbox across the state, starting with the 20 emergency departments with the most visits, and that data came from the CDC project that we're here talking about today.
And also, I do want to comment and say that I'm one patient that I do have a care plan in place for, if I were to go to the ER. It does help. My advice to sickle cell patients or to everyone, make sure you communicate. You have to make sure you talk to your doctor and make sure if you're not able to talk while you're in the ER, have somebody who's with you, but let them know that you have a care plan. And it does help out in the ER. It speeds up the time, actually. Not the waiting area time, but the duration, the duration of having to be in the ER. Care plan, it does work. So that's a good thing that we do have in place.
I'm listening and I hear about care plans. I don't have.
I'm glad that everybody that's on that panel, that, you guys are doing a real great job. I myself, I live with sickle cell. I'll be 50 this year. I just said, I heard the same thing that you guys heard. Growing up, I grew up in West Africa, in Nigeria, and right before I came into the United States. So I've heard the same stories, but I don't ever let that beat me down or hold me down. I just keep going with it. The one thing that I just want to say is, for those who are living with sickle cell, it's very, very important to know, your blood type. Whoever you're dating, you have to. That way, we don't create sickle cell, kids growing up. So, that's just something that I just want to share with everybody.
I'm hearing about care plans. And I understand that we have doctors and nurses to provide that. But for me, my care plan is God. And He comes first. And He has gotten me this far. So when you talk about care plans and the doctors, yes, I do see my primary care. But with everything else, I rely on my faith. And my faith is what keeps me going. The love of my friends and my family, that's what keeps me going. That's my care plan. And if that would work for you to add on to what you have, or you have, add it. Because we wouldn't be here without it. So I just want to share my care plan.
That's great. Thank you.
do want to speak to the importance, I don't know, maybe on the level from the patient with their hematologist, we really have to start talking about nutrition. We do. Back to Mom Act when she was talking, we really need to educate, we're all from different walks of life. We all have different access, and nutrition is key, because if it's important for just your person, normal person, right? If nutrition is important on that level, what would it do if we were educated about nutrition and how it would help with the quality of life living with sickle cell disease? I will say that prior to September, I had been for 5 years sickle cell crisis free, like hospitalization free. And I am huge on nutrition, what you eat. I'm not gonna say, oh, you can't eat me, you can't do this, but balance. What you're eating, lifestyle, it's a lifestyle. And if we can start there and start really young, I start with my son, I made it up in my mind that with him and his dad, his father and I, we're gonna be intentional about what he's eating, about him, teaching him to make good choices. You can't be perfect, but there is balance. Doing as much as you can as far as working out, movement, mental health, all of those things, because living with something like sickle cell disease, oh my goodness, the mental effects. We don't even have the time today to talk about that. That's another thing. Mental health, nutrition. Those are the things that are on my agenda. Like, that is extremely important, and to impress upon people. Start where you are and take those small steps. But we really have to start speaking to nutrition and how that will affect the overall quality of life of anybody.
Warriors, you all, I am so grateful that you all did this. I just turned 30. You guys gave me so much inspiration.
Can we give our panelists and our moderator a hand for the wonderful job in inspiring the words and today? Greatly sharing their experiences with us this afternoon. For those who are going to take the tour, can you raise your hand, please? Okay, I'm going to ask if you could walk to the back of the room. Is Karen back there? Okay. We're going to follow Karen in the back, and you can make your way to the tour. They will show you where you're going to be going. Don't forget to take all the things you brought with you. And for those that remain, I just want to quickly acknowledge the team that makes up the North Carolina Sickle Cell Data Collection Program. So could all the partners who are in the room stand up and wave your hands, please? Okay. Can we give them a hand? Thank you so much. Thank you all for coming today. That's it. Enjoy your evening. Safe travels, particularly to those that are coming from Atlanta, Raleigh, Durham, and other places around the state. Thank you so much. Thank you for your support, and enjoy your evening.
Thank you. Thank you guys for caring.